for staying with us. Reducing stigma and ensuring access to quality mental health care in Ghana remains a mission yet to be achieved, despite the enormous efforts made in the sector. Non-governmental organizations which have attempted to complement government efforts get overly stretched due to the immense need for human and financial resources. Now, citizens are demanding immediate government intervention for holistic health care for the mentally challenged who are spread across cities and communities. Hannah Odami has been explaining the case of mental health care in this feature titled Minds on the Streets.
Sometimes I feel very bad because some are very young and some are very old too, and some too they are not clothing well, so sometimes you feel bad about it.
It is not only about how they feel, but the pain they can also inflict on anyone they come by. In August 2022, a mentally challenged woman hit a man with stones at this particular spot. For those who stay and live around, it was a moment of reawakening. For how long are they going to tolerate or look over their shoulders when they see a mentally challenged person in their vicinity? That torturous incident lingers on the minds of many who heard it, but most especially on the minds of those who witnessed that horrific act. The thought of being attacked, abused, or beaten by a mentally challenged person is an act no one would want to experience.
It's quite frustrating of late. I do meet them. Sometimes they come towards you whilst you are working, and you are a little scared, especially during the nights, and you feel you should run away. And when you try to, they try to follow you. It is something which is really, uncomfortable. And I feel the government should, in a way, try to put them together in one place. Some are very threats to life.
That intervention to get them off the streets was announced on March 2022 by the then medical director of the Accra Psychiatric Hospital, Dr. Pinaman Apau. She revealed the redevelopment of the facility into a 220-bed hospital was under government's Agenda 111 program and was part of many other projects, including the construction of 101 district hospitals, 6 regional hospitals, and 2 psychiatric hospitals.
The first date that was communicated to management was the end of June 2022. However, updates that I got recently from the coordinator of the Agenda 111 project indicates that currently they are doing what we call technical evaluation on tenders that had been submitted.
But almost a year on, not much has happened in terms of a pull down and a facelift. One would think the facility hosting some of the mentally challenged persons in the national capital will be rid of their presence around their premises. But that's not what we see here at the Accra Psychiatric Hospital, with some of them reserving permanent habitations around this place. Passers-by and residents are uncomfortable.
So we will feel very bad because it is not good for somebody to carry a stone and throw another person, even the person is not a madman or the person is not a mad woman. You understand? We call it a little violence. It's something that is not good at all.
Former director of the Accra Psychiatric Hospital, Dr. Akwesi Osei, delving on this development.
As at the time the idea came to pull down the structures and build new ones, we had got to the point where it didn't seem fitting for a facility of our age in Ghana. So the idea was to pull it down and rebuild it. All things were more or less in place, but somehow it's stalled. I'm sure it's not totally dead. I'm sure the plans are still there, that somewhere along the line you'll get the funding to continue the program. And that was it. Now, you mentioned two new psychiatric hospitals. Yes, one in the northern belt, one in the middle belt. As far as I know, they are still on the drawing board. Land has been secured, and they started building them. So we hope that funds will continue to be available for them to finish building them. And if they finish, it will be wonderful. Because for now, all our three facilities are down south.
As the nation waits to see the fulfillment of the redevelopment promise, we should have seen the completion of the redevelopment promise. The mentally challenged on the streets will perhaps remain, and the fears of many will also perhaps remain.
Some of them, in fact, they look scary, and I think it is not right to be walking on the way and maybe coincidentally you run through them, and then some of them, in fact, what they can do to you. And because he's a mad person or mentally challenged person, you can't take him or her to court or anything like that.
I am Hannah Odami for Joy News.